So I think Rachel's going to give us her vision for the future of respiratory care. So I'll hand over to you, Rachel. Thanks.
Thank you so much for that lovely introduction. Now, can you hear me okay?
Yes,
great.
You're good. And as I said earlier on, we're going to do questions at the end. So
great. Now, I'm just going to ask you just to see if you can see my first slide. And when I move on, please just let me know if it doesn't work.
It's perfect at the moment. I'll shout if it doesn't.
Thanks so much, Jo. So, hi everyone. I am delighted to be here. So I can't see myself now. So I hope I look okay. My name is Rachael Moses, and I'm delighted to be joining you today to talk about the future of respiratory care. And I'm going to talk about what this means for me from a corporate perspective in my roles, as Jo mentioned, but also bringing in the clinical element to that. And I understand, and I've seen from the word cloud there, we have a diverse audience here today from different professional backgrounds. And that's really incredible to see, because this is really the future of respiratory care. Now, I'm also aware that I'm currently sat here in Newcastle, and I couldn't be any more north than you guys all right now. So I'm going to try and keep my posh voice on, which is this, believe it or not. So if I get more Geordie as I go along, please someone just give us a shout. And I'd like to start by saying I feel incredibly privileged to have had the opportunity to work in a number of roles, as Jo mentioned, across health and care. And having left a provider organisation in the summer, I'm now working on what I understand to be a portfolio career. And I didn't really understand what that meant, to be honest, until someone described it to me. But here I am, and I currently work 1 day a week in personalised care. So I am a national clinical specialty advisor for respiratory, which includes long COVID, and that's within the personalised care group, part of NHS England and Improvement. And I also work 4 days a week in my head of clinical leadership development role, part of the Leadership Academy, also part of NHS E&I. And most probably important for this presentation, I also continue to work part-time as a consultant respiratory physio. So my corporate perspective is definitely going to bring in my president-elect, soon-to-be president position. Now, I'm going to move on to the next slide, but I am getting a bit of background, so I don't know if someone's not on mute. Just to mention that. So I wanted to take the opportunity to share a little bit about my career. So as Jo mentioned, I am the first non-medic of the British Thoracic Society. And why is that important? Well, you know, here's little old me, you know, the girl from Moore's End in this really important profile role. And I often think, like, you know, what's the point? Why am I here? And I think there's great leaders that have come before me and inspired me. And, you know, I know Julia is co-chair of this group. She's one of my inspirational role models. And I think it's really important to go back to why we all joined healthcare and what inspires us. And I've been qualified just over 20 years as a physio, and I specialised quite early on in my career after having an inspirational student placement. And for this reason, I'm so passionate about undergraduate education and inspiring the next generation. And I've actually worked across the UK in the Northwest, the Northeast, the Midlands and London, and spent time on deployment as a British Army officer, and very fortunate to do humanitarian aid work. And one of the most important things about all of this has really been my pathway into the more senior roles in my career, including the presidential position next month. And this is really a shout out to you all listening to say, take these opportunities that come your way, you know, whether it be to work on a guideline group, whether it be to work on a policy paper. There's great opportunities coming up for the integrated care services and systems, and it's really just not thinking you don't belong in that space. Like, we need diversity of thought in those spaces, and I think the doctors are really good at this, at putting themselves forward, and we need to follow their example and also be in that space regardless of our professional background. So my first acknowledgement for the future of respiratory care is the recognition of healthcare inequalities that have further been highlighted during this pandemic, and these inequalities have always been there, but we've just never really fully recognised them or given them the priority they deserve. So now is the time to do that, and this is everyone's responsibility, including organisations. So let's start with the corporate perspective. So this is the BTS strategic plan for 2020-22. And as a member organisation, we currently have the largest membership we've ever had. And from the 1st of June 2021, we had 4,069 members. Now, I'm going to be completely honest, we're not entirely sure what our membership looks like, and that's something that I want to look at in the next 12 months. But it includes doctors, nurses, physios, physiologists, scientists, pharmacists, speech and language therapists, and other professionals that have a real respiratory interest. And many join because of the opportunity to influence policy and education to better the profession and patient care. And we are a registered charity, not many people know that, and a company limited by guarantee. And we also cover the whole of the UK with representation from the 4 nations. And I do have to admit, a lot of our language is very England-centric. So we need to continue to be inclusive of our Welsh, Scottish and Northern Ireland colleagues, as well as continue our global output. And one of the things we're really proud about is including patients, public and carers in everything we do in terms of planning, delivering and reviewing all of our activities. So here is our overarching vision to ensure better lung health for all. We have clear mission and objectives, as well as overarching themes across each of our priority areas. And we have a huge focus on prevention as well as intervention. And reducing tobacco dependency has been a key focus of the work of the British Thoracic Society for a number of years now, with newer themes added in, for example, sustainability and digital. And as I mentioned, reflecting diversity in every sense. That's the workforce, that's reflecting the diversity of the patients that we care for, and really combating and reducing healthcare inequalities so they don't exist for the future. And the biggest threat we have to health and care currently in the UK is workforce. I don't need to tell any of you that. And at the British Thoracic Society, one of the things we're really committed to do is increasing our presence and influence across every single strategic and operational levels. So our work with the all-party parliamentary groups, for example, we've had a huge presence through our National Clinical Director for Respiratory, Andrew Menzies-Gow, in the asthma, APPG, and also the long COVID work, which we will continue, and working alongside the Academy of Medical Sciences. For example, they have started grants. Currently, they've got one out for TB research, and as well as our work on winter preparedness. So as clinicians, everything we should be doing is centred around delivering better respiratory outcomes for patients. And now we have the commitment that respiratory disease is a priority in the long-term plan. This has to remain the focus for the future, delivering better respiratory outcomes for people. And at the British Thoracic Society, we bring together respiratory clinicians. So this is one of our convening roles, to bring together experts by experience, people with lived experience, and also other key stakeholders to work on specific publications to support the development and implementation. For example, our work on the MDT, Respiratory Support Units, which was a collaborative piece with the Intensive Care Society. And we work both alongside GIRFT, so the Getting It Right First Time national programme, and specifically the respiratory work stream. I'm sure many of you will know Dr. Martin Allen, MBE, who is a real strategic driver of this, as well as some of the clinical practice guideline recommendations, for example, those published during COVID. So we know the impact of both quality care and continuous improvement, and quality improvement work is so important for us all. And we do tend to focus on these 6 dimensions of healthcare quality improvement, ensuring care is safe, effective, patient-centred, timely and efficient. And we have a number of QI initiatives within the British Thoracic Society. And in the UK, we have really led the way in clinical guideline development, and particularly with reference to respiratory medicine, for well over 30 years now. And our quality standards are a key part of the supporting information that comes alongside the guidelines to assist the implementation and really make them clinically relevant. Now, our clinical statements have been around for about 5 years now. They're a much newer piece of work, and they provide a snapshot of knowledge and best practice in priority clinical areas. And our clinical resources showcase initiatives from both within and outside the society to help translate this into clinical practice. And we have a whole separate section on lung disease registries in the 3 disease areas: IPF, sarcoidosis, and multi-resistant tuberculosis. And to give you a flavour of our recent QI work, it includes air travel, guideline on long-term macronide use, and quality standard on venous thromboembolism, as well as a clinical statement on occupational asthma. And we are also internationally recognised for our clinical guideline statements, as well as our collaborative work with other organisations. And this is only achieved from the incredible members who are experts in their field. And it's really important at this point to stop and note we need representation of all members of the MDT at the decision-making table to influence and implement best practice recommendations. So please, if you are listening to this, the only way we can deliver better outcomes for respiratory patients, for our patients, is for you to get involved. We need you, and this is the future of respiratory care: interprofessional working and multidisciplinary representation. So the future of our world has to be smoke-free. The elimination of tobacco-related lung disease in the UK population has been a key BTS objective for well over 30 years. And 2 other female, particularly past presidents, were particularly passionate about smoking cessation and tobacco dependency. And we're thrilled to see that their offering of smoking cessation advice and support in hospitals is a clearly identified objective in the NHS long-term plan, alongside respiratory as a key priority area. And one of our most recent initiatives is the BTS Tobacco Dependency Project, launched just recently in 2021. It's a 3-year project which will involve supporting clinicians and those who provide smoking cessation services to implement and improve tobacco dependency treatment. And it will be complementary to the smoking cessation services identified in the long-term plan. And the real specific offer is to provide NHS-funded tobacco dependency treatment within acute mental health and maternity services. And it will really support sharing, supporting, disseminating, updating information over the next 3 years and beyond. And this is just an example about how you can get involved right now. We have a call out for people to join the medical management clinical statement group. We're looking for a chair, we're looking for members of the group. Visit the website. We're really hoping that this can be a real multidisciplinary effort. And pharmacists out there, please get involved. We need you. And we're very hopeful that smoking cessation services will be in the community, will be appropriately funded, because this has been a massive funding deficit for too long, and we will continue to lobby that. So integrated care is not anything I need to explain to you all. It's the future of how health and care will be delivered as part of integrated care systems. And I'm sure you're all cited on this. And I'm also pretty sure that you are aware of this incredible platform and its resources. Respiratory Futures is a platform for resources to support integrated respiratory care, commissioning, innovation and networking. It's a partnership with the BTS and NHS England, and its focus now is to help the implementation of the long-term plan for respiratory services, but also works across the entire respiratory UK sector. And there is references to Scotland and Wales respiratory plans as well, as trying not to be too England-centric. The aims are listed here: to foster the sharing of best practice, reduce duplication, and support the development of new models of care which best meet the patient's needs, to help to reduce healthcare inequalities. And on this site you'll find interviews, news articles, case studies covering innovative models of care. There's a lovely piece on occupational therapy outpatient services for lung cancer patients. I tweeted about that last night. I was just having a little update myself on the website. And It includes important topics, for example, the Philip Morris International acquisition of Vectura and new projects in the respiratory field. So often these things that might not make a journal or a scientific conference, these are things that people are implementing in real life, and resources can include anything from these local initiatives through to publications, but really anything that's posted on here is what's happening in real life. This is real life healthcare. And I do encourage you all to submit your innovative practice to the platform. Don't think that it's not good enough, it will be. And it's really important we share best practice for the future. And as you can see from the respiratory support units, there, the picture in the middle of the screen, if you click on that, there's a series of 5 case studies. Now, I've just screenshotted this one because it was very concise. The other ones are a little bit long. But really what it does is it gives you just a little bit of a snapshot of how the guideline documentation and the recommendations are being put into action and what the output and outcome is in this. And this is really important for commissioners because it makes it translatable into what's happening in another organisation. So again, really encourage you to jump over. Now, Future NHS is another platform, and I think, I don't know how many people are using this actually. Every time I mention it in a presentation now, people say, oh, I didn't know about that. But it's another online portal which connects a much wider platform across health and care and also the public. So it contains workspaces that are self-contained area with its own membership dedicated to a particular project, programme or subject area. All you do is put in the search category and then it'll ask you if you want to join this workspace. And for an example of this, here's your platform, for example, the Kent and Surrey and Sussex Respiratory Future NHS platform. You can search in long COVID, for example. This is one thing in my personalised care role we're very active in. You can post a discussion. So there's me posting one last night about personal health budget implementation sessions. And there's also an entire section on the platform for previous recordings, webinars. So you know, if you're ever wanting to find out a little bit more information, this is free, accessible, really relevant information that you can access as health and care professionals. So, personalised care, a real passion of mine. There's so much evidence to support personalised care, and as I've mentioned, I work for the Personalised Care Group as a clinical advisor for respiratory, so I thought I'd cover a little bit about this. It's such an important concept, but one that's often forgotten, and we all know what matters to the patient should be the absolute focus, but in modern medicine sometimes we do tend to treat the disease or the condition and not necessarily the person that has the disease or the condition, and this needs to change for the future. And the whole focus of the comprehensive model of personalised care is to focus on people achieving better health and wellbeing outcomes by accessing specific personalised care. And this is only going to be achieved by adopting this whole population approach to supporting people of all ages and their carers to manage their physical and mental health and well-being. And by doing this at population level will help build this community resilience, enabling people to be more informed about decisions and choices they make with healthcare. And obviously prevention is a huge part of this. And there's a number of interventions that make this possible. For example, shared decision making, treating people as equals, social prescribing, community-based support, and onward referral into non-clinical services as appropriate. And this has never been more important than ever. And if we move up the pyramid from the whole population, we have people living with long-term mental and physical health conditions. They make up about 30% of the population. And a personalised care and support planning approach builds on the knowledge and skills that we have. And this gives the people confidence to better manage their health and well-being through targeted interventions. And this is brought together in this single personalised care plan that we talk about, with what matters to people being at the centre of that. This is where things like patient activation measures can come in, and they're useful sometimes to target interventions, and can include things like health coaching and an access to peer support. And I think we're seeing some, just look at pulmonary rehab. A huge part of pulmonary rehab is that peer support, getting the cup of tea after the session. You know, we cannot underestimate the experts by experience in help managing their condition and the support they can provide to others. And the next group of people are these that have the complex health care needs. They're often living with multiple long-term conditions. This is about 5% of the population. And a personalised care approach here provides intensive specialist interventions to empower patients by integrating care and support and prevent emergency interventions. This can include things like personal health budgets, integrated personal budgets, integrated personal commission. And it's really important, as you can see by the arrows, that this model is flexible to the changing needs of the person. And there's huge evidence to show that this gains full benefits, not just for the person, but for the system. And I have to say, this is where workforce comes in. So speaking specifically in my consultant physio role in my previous life, working in a regional long-term ventilation service, people with very complex healthcare needs, you know, this is about empowering all of our healthcare clinicians, our medical consultants, I hate the term non-medical consultant, but there's, you know, that incorporates therapists, nurses, advanced care practitioners, and really bringing experts to the table. So I'm never shocked to know how many people don't know about the free and accessible resources within the Personalised Care website. And this training is available to all healthcare professionals, regardless of professional seniority. So 85% of healthcare professionals who complete our courses are very likely to recommend them. So this is nothing to do with me. This is just something that I've been more aware of in my personalised care role. But I do encourage you all, if you're not trained in personalised care or you haven't seen this website, just to jump on. The learning modules are free. They're accessible in the 30-minute e-modules, and they're accredited. So you'll get like a notification and certification after you completed in personalised care. They also have separate sessions, say on shared decision making, personal care and support planning, and they also have like accredited training courses and webinars, masterclasses, podcast series. Do go and check it out. Also great for students as well, if you have students on placement or if you do any work with undergraduates. Another area of mine, we are coming towards the end. I'm not sure what I'm doing for time, but another huge passion of mine is healthcare leadership. So this is a simple concept, often neglected. In my other role, as I mentioned, is with the NHS Leadership Academy, and I joined here just over 2 months ago from an NHS provider organisation, with the main driver for me personally being able to influence and embed clinical leadership for the current and the next generation, and having experienced the very best of healthcare leadership and the very worst, I took a leap of faith to try and influence nationally. And one of the things I've learned is that people don't know a lot about the Leadership Academy offers. So these are our flagship leadership programs. The Edward Jenner is incredible. It's I've done the Edward Jenner previously, maybe about 10 years ago now, actually. But we have consultants doing the Edward Jenner, we have surgeons, we have, you know, very executive leaders, directors starting at the entry level program. It is basic for those that have leadership skills, but it's really the foundation. You sign up with any email, it's accessible to anyone in the world with an email account, Gmail, Hotmail, whatever, it doesn't need to be NHS. You get automatic registration and you can complete it in your own time. And again, this is something that we're really trying to reinforce our undergraduates and our healthcare students participate in. And some universities do offer this as part of their undergraduate training in terms of a module. We also have the bite-sized learning areas, again, free, accessible, 30 minutes. They're so easy to use. They have targeted and directed study projects, for example, that come alongside them. Can be used again with our student, undergraduate staff, and anyone to really help understand. We've got things about compassionate leadership, we've got having difficult conversations, etc. And we do have a suite of offers for those more senior leaders. For example, Project M is something that's been designed through the pandemic through our marketing team that looks to support and connect leaders across health and care. And we have the executive suite that has very specific offers for those working at very senior clinical level and leadership and management level as well. So do pop along and visit there. And of course, we have our regional leadership academies. They have really strong links with organisations across the regions, and they look to co-produce effective interventions at both individual, team, organisational, system levels. They have highly skilled pool of experts that are part of the academy, but also external. And we have some of the best healthcare leaders within our faculties who we commission to lead bespoke and tailored programmes, as well as our flagship work within the region nationally. So please use it. It's there, it's funded, and we want to support frontline clinicians and people who are delivering services, and they really just want to either improve their leadership skills or continue on this lifelong leadership journey. And they have loads of things, but within this specific regional academy, they have what they call the leadership shorts, which are short recordings of sessions of key leadership topics that are delivered by people within the region. They have these leadership expressos, and I tell you, the number of events they've got from now into next year is incredible. So do please have a little look on, because they're just drop-in sessions, and a lot of the time if you sign up to it, they're recorded and they'll send you notification that they've been recorded and it's available. And it's not just around specific interventions, it can be around, you know, having challenging conversations, how we can influence, and of course on things that are going to specifically address inequalities, not just for our patients but for our colleagues as well. So just in summary, this is my final slide. I just want to acknowledge the incredible work that everyone will have done throughout this pandemic, you know, as a clinician, but also as a healthcare leader and as soon to be president of the British Thoracic Society. But we are exhausted. As a nation, we're exhausted. There's no denying that. And the continued impact of the pandemic is telling. But as a respiratory profession, we do have a platform like we've never had before. We've got a profile we never had. And we need to use this to our influence. We need to know where we influence, both strategically, operationally, professionally. And personalised care has to be at the foundation of all this, as well as shared decision making, to really make sure that patients and people are at the heart of healthcare delivery. But we also need to invest in our own development. Leadership has to be for all. Use the free resources that are out there and connect with your academies. We need to ensure that your voice is heard. You know, for people listening to this, get involved. You know, don't think you don't belong in that space, because you do, and I'm a classic example of that. Whether that be within your professional societies, you know, the specialist group, the member organisations, the ICS boards, whether it be on guideline committees, NHS England and CPOD, whatever it is, make sure you're using your experience outside your own sphere of influence. And by doing this, we need to empower ourselves and each other, and that is the future of respiratory care. So thank you very much. I'm going to stop there. If I can try and stop sharing my slides. I hope I was on time there, Joe.
You were. Thank you. I'm just giving you a clap there. Sorry. we miss we miss seeing people face to face, and that interaction. It's really hard to deliver a talk, isn't it, when you've got no feedback? I find it hard, but thanks so much. That's inspired me. Yeah, we've got more claps. That's great coming. So I'd like to open up to questions. As we said earlier, if you put your hand up, Julie will keep an eye, or if you'd like to put your question into the chat. We are actually going to try and set up a poll for you, Rachel, to ask the question about whether people are using the NHS Future platform. It's certainly something that I use, and as you say, it's got some great resources on there. So we might not get that done till the end, but we'll let you know the outcome if you're not still with us. Okay. So I was interested in all the free resources for personalised care. That looks good. Can you just clarify the Leadership Academy? Are they free, or some of them free? What's the situation for those?
Yeah, great question. So our Edward Jenner is free, the entry level. The flagship programs, they come with a charge, normally funded by an institution, but we often, and this is why it's really important to get involved, we will often fund places, or we'll ring fence. But also what we do is tailored program work as well. So for example, as part of the NHS long-term plan, there was a significant investment for consultant mental health nurses. So what we've done in my team, the national team, it's a very small team, but my role is head of clinical leadership development, and we have a allocated budget. It's not massive, but we can work wonders with it, and we provided a tailored clinical leadership program for consultant mental health nurses. So if there's something that we can't meet your needs with within the academy, we can provide tailored packages through the regional academies. They have their budgets as well, and also through the national team. So our bite-sized learning opportunities are some of all the stuff you've seen now in the regional academy, that's all free and accessible. So it's more that, and when I talk about the Edward Jenner is normally can be completed within 6 months, in your own time. Like we don't encourage stuff in people's own time, but it can be. That's one of the reasons why it's the foundation. But the next level up, their commitments of like 9 months, 12 months, some of them 2 years, the executive programs. So yeah, but there's loads there.
Edward Jenner, good to get started and then look at the regional thing. I think just generally encouraging people to. I think you're right. People sometimes don't put themselves forward, but we know from clinicians in our areas who've really sort of led their teams, particularly around the COPD and asthma discharge bundles, and presented on that. So I'm going to just encourage people to ask questions in whichever way you want. Julia, just handing over to you.
Yes, I mean, at the moment, curiously, there's no hands up and no questions. So I'm going to take the opportunity to jump in.
Oh, God, be nice.
Of course I will. Of course I will. So, Rachel, you've obviously given us an overview of an enormous portfolio. And even within just the BTS alone, that's a very large portfolio. And here on this call, there's probably a lot of members of the BTS from all professions. So of all the things that you laid out there, where does your heart lie? And in your presidential year, what will you be particularly focusing on yourself and driving forward? And what will you try and, encourage others to lead on?
Great question, Julia. And you have a little bit of insight knowledge, because I've done a very short interview with you, haven't I, as part of my presidential address. Not going to give too much away. One of the things, Joe, about the leadership side is coaching and mentoring. And Julia, this is coming in to answer your question, which we provide free through the academy. But Julia, one of the things that's really passionate to me is I've been doing my homework TS in the presidential role is about understanding our membership. So number one, we're a membership organisation. We don't really understand what makes up our membership. Now, why is this important? Because professional identity is really important to people. So when you're othered is a profession. So when Julia, I'm not going to disclose your age here, but it's nearly 30 years ago that you joined the BTS, and I think physios, there's a lot of people who don't have a category, like the speech and language therapists have only just got a category. They were othered. So what does that mean when you don't have the tick box to be there? And this is not just about professional identity, this is about your ethnicity. So we know how it feels when you're invisible, you then become invisible. And also about sexual orientation, about gender identity. Why is it important that people can self-identify or not? It's their right to do that. So for me, it's about understanding the membership. It's about ensuring equity for all of our members. So we need to acknowledge the disparity findings from COVID, on top of the healthcare inequalities, on top of the the RES and the DRES data that our healthcare colleagues know. We know from people from LGBTQI plus background have poorer access to healthcare. That includes respiratory. We know that people from LGBTQI plus communities are more likely to have mental health conditions or smoke. And we also know that our colleagues our colleagues are not treated the same as heteronormative counterparts. So we have a lot of work to do in this field. Why is that important to the BTS? Well, I'm president in the next 12 months, and it's important to me. And that is a key part of my intention, if you like, over the next 12 months to understand the membership. I've been hosting listening events for those members from LGBTQI plus ethnic diversity backgrounds and disability backgrounds, as well as trainees and as well as open sessions. So I'll continue to do that. And of course, making sure the patient, voice, people with lived experience, experts by experience are fundamental in what you do. The selfie shots, it's a thing, using social media in that. So yeah, it's maybe going to be a bit of a time for change for the society, Julia. Maybe if you think back to when you joined, I don't know. I'm aware of my critics. I'm aware of the people who maybe aren't ready for this. And in the words of Mike Morgan, don't bulldoze that door down, Rachel. Lean on it softly and gently, it'll open. You can't ram this stuff down people's throats. So I'm really lucky to have those really wise, weathered shoulders around me, as well as real new, fresh opinions. I have diversity of thought in my circle, and I'm super grateful for that.
Thank you, Rachel. And there are a couple of very nice comments in the chat. Fiona Conduit says, thank you, Rachel, an inspiring vision. And Vicky Knowles says, excellent update on all the opportunities available, and thank you. So, Jo, there aren't any questions in the chat.
And so just to Fiona's physio background, I hope you don't mind me saying that, Fiona, and Vicky's a consultant nurse specialist. So two of those representatives, that's great. So I think, unless there are any questions, I think we can ask that Slido question, and then you can see, Rachel. So Sharon, can we, if that's okay, Rachel, can we do that?
Yeah, that's great.
Yeah, let's see what happens. So Sharon, can we put that Slido up? Oh, great. So people are on it already. So we have a KSS page that we post things on. So it's just letting people know that not many. Oh, if we go back to the other one, I think there's still people to answer actually, Sharon. Yeah, thanks. Just maybe people are having to come in again. Yeah, the numbers going up there, so just let people. So slightly more not than yes. So that hopefully is let people know about that platform. It is. I think it is pretty useful actually. And then if we go to the next one, so if you're not using the KSS page on Futures, would you be interested in using it? And not many. We'll let just people answer that question. Okay, great. Thank you, Sharon. So does that give you a flavour, Rachel, of yeah? Okay, good. Thank you very, very much.